Good afternoon, everybody. My name is Dr. Chris Bird. I'm here with Public Health Director Annette Rodriguez, uh, Jason Lewis, and Tiffany Anderson, all from the COVID-19 Task Force. And we're here today to do a question and answer session based upon the questions that we've been receiving from you, the public, over the past week. We have two topics we're going to cover today. One is the focused on the case reporting and the developments with the pandemic directly, and then topic two will be vaccines and questions surrounding the distribution and effectiveness of vaccines. So we're going to get this started right off the top. We're talking about COVID in the local community. So now, people are wondering, does anybody know how many residents are in long-term care here in the Coastal Bend?
And actually we do. For Region 11, which is our area, there are 9,035 residents for Region 11 that are considered nursing home residents.
Okay, and do you have any COVID numbers for them?
That are considered nursing home residents. I don't have a specific number for how many residents have become positive with COVID-19, but we have had our share of COVID positives in residents as well as in staff working in long-term care facilities.
Okay, right, thank you. I see we're getting a lot of cases, but there's been this kind of plateau in the hospitalizations that happened around Thanksgiving, and people are wondering, are the Eli Lilly treatments helping to work to keep those hospitalizations level and not rising?
You know, we believe that is helping. So there's the Eli Lilly, the monoclonal antibodies, as well as the Regeneron monoclonal antibodies that we have received over the last few weeks. And so these antibodies really seem to be helping to keep those numbers down, but these are only for COVID positive patients with mild to moderate symptoms. These are not for patients that are acutely ill or that are hospitalized or that are on oxygen. So, but it does seem to shorten the duration of the illness and keep them from being hospitalized.
Right, and in order to get these treatments, you have to be outpatient, right? Not in the hospitals.
That is correct.
All right, thank you for that. And I know that every week I emphasize that with the fatalities that are reported, COVID was listed as the primary cause of death. Some people are wondering how many deaths list COVID-19 in Part 2 of the death certificate, which would mean that that's a secondary cause of death, but not the primary cause of death.
Yes, for Nueces County, we do look at all of those death certificates once we receive them, and we have only seen one in the total number of deaths COVID-related that has secondary cause of death to be COVID-19.
All right, thank you very much. That's the questions that we got on social media this week. I'm wondering, Jason and Tiffany, do we have any additional questions for general COVID pandemic-related issues? It sounds like no. So we're going to move on to the second portion of the question and answer session, which deals with what everybody wants to talk about, vaccines. I think there's a lot of questions about vaccines. What happens when we have this super cold vaccine? How do we get that injected into our bodies? How does it work? So on that topic, first, and this is for you, Annette, is the vaccine going to be safe? And the context for this is that this woman and her husband, they're going to be 81 next month.
And so, you know, what we've seen, and I don't know if anybody watched the FDA panel review yesterday. If you didn't, you can go on the FDA website. It's a really interesting review, and they talk about the efficacy and the safety of the vaccine. They spent all day yesterday discussing this. You know, there was some questions about if you're over the age of 80, because they're looking at those people that were actually in the clinical trials for Pfizer, and there was 44,000 people that were in these clinical trials. But for those 80 and over, there were not those large numbers that they would have liked. What we do know is that it was voted, the panel voted, 17 voted yes to approve it. They believe that the the benefits outweigh any of the adverse reactions because of the pandemic level that we're at. And 4 of them voted against it, but the 4 that voted against it all had concerns about the age group 16 and 17 years of age, and that's why we believe they voted against it, and 1 actually abstained. So the recommendation to push this vaccine forward will be for recommending that the FDA does approve the EUA, the emergency use authorization, for us to start receiving Pfizer vaccine next week.
Right, and I'd also read that there were concerns maybe not being about being 81 years old and getting the vaccine, but more about who should be getting the vaccine instead of those people. I know that one dissenter, that was the type of argument that they had made when they voted against that. I'm going to follow up on that question. Are there other groups that we're not sure yet how whether it's safe for them to have the vaccine?
Well, just going back for a minute to the 80 plus. So one of the findings that I thought was really interesting was that 65 years and older, those groups tend to show less adverse reactions. So which we thought was really, great news, and interesting, but probably too because their immune system doesn't work like the younger population. The vaccine was initially for 12 years and older because they did have some 12, 13, 14, and 15-year-olds in the phase 3 clinical trials, but everybody decided that there was not enough of that age group, the 12 through 15, so they only voted on 16 years of age and up, and it is the only vaccine that we see as one of the vaccine candidates that has children, at all in that group to be vaccinated.
Okay, how about pregnant women?
Pregnant women, there's still some controversy around if pregnant women should get vaccinated as well as young children. So they're still having those conversations. The FDA is meeting today. They will also meet tomorrow. We're hoping that by the weekend they will approve it, and they'll have decided on what age group and what target populations will be receiving those vaccines. We all know that people with severe allergic reactions is going to be talked about as well because we've seen this in the UK. And so they're talking about if you have to carry an EpiPen around, you probably are one of those individuals that should not get vaccinated with the Pfizer vaccine.
Right, and just one last group I wanted to ask about because I did read a newspaper article that indicated that there were some questions about people who had been infected with COVID, whether they should get the vaccine or not. And I was wondering if you had any information about that.
Yes, and that question is being asked a lot, and the answer is still yes, because we know that individuals can get a reinfection with COVID-19. And so they are recommending that if you've had COVID-19 in the past, that when your phase comes up or your tier, that you do get vaccinated for COVID-19. They're also said today that you can get vaccinated for the flu and COVID-19 on the same day, and it should not have any adverse reaction between the two.
All right, yeah, thank you for that. And I think it's important to point out that if you're actively infected with COVID, you shouldn't have the vaccine right now.
That's correct. Anytime you're ill, you don't want to get a vaccine. You want to wait until you're completely recovered before you receive a vaccine.
All right. Okay, will there be enough vaccine for the second dose in 21 days? Is there any risk of everybody getting the first dose and then us not getting the second dose because of a supply issue?
No, if the plan continues the way they've organized it and told us that it was going to be handled, the federal government, the CDC, actually, whatever allocation they give to hospitals or health districts or providers, they're only giving them half of the doses. So if the health district was to receive 4,000 doses, they would be sending us 2 because they're going to send us those other 2,000 doses in the 21 days because Pfizer is 2 doses to have received the full vaccine, the first dose, and then 21 days later you receive the second dose.
Okay, and I'm really bad at making appointments. How are there systems in place that would help somebody like me that might forget about the second dose?
So for the health district, what we're doing is we have a software system, and it's the same software system that people have utilized to come through our drive-thrus for COVID testing. So they're going to sign up online at cctexas.com, And once they sign up and they get vaccinated, when they hit submit, that's the consent that they want to get vaccinated. And once they get vaccinated, our system will automatically send them out a text as well as an email reminding them that it's coming up on the 21 days. And it'll send them a link so they can actually click on it, go to the calendar, and sign up for that second dose.
Okay, thank you. And what happens? Just say that it's going to happen. Some people aren't going to get the second dose at the right time. Will they get any immunity conferred from just one dose, or will they need to go and get dosed again, or how does that work? So you missed your second dose.
So what we know at this time, what we heard was after you receive the first dose, it takes about 2 weeks though for your body to build immunity. And so you should have a 70% protection, but we're trying to get everybody at that 95% protection, which means that you have to take that second dose if you're trying to get that full 95% protection. What we don't know right now is with a second dose, like any other second dose vaccine that we have, you don't have to do it exactly on day 21 or else. They usually give you plus or minus some time. And so we're trying to find out what that will be, and we're waiting to see what those inserts say so we can give that information to the public as well.
Right. Okay, thank you. Regarding the vaccine numbers for Nueces County, how is this going to affect surrounding coastal Bend counties? Are they going to get some too, or is it just going to be Nueces County that gets the vaccines?
No, everybody is going to get vaccine that has signed up as a provider. And that's why it's so important that providers sign up. Here in Nueces County, we know that we have 81 providers that are signed up. So that's great news for us. Normally with our regular childhood vaccine, we normally have about 75 providers. But so far, right now, we have 81. San Patricio has 16 providers that have signed up. Aransas Pass has 6 providers that have signed up. So there are providers signing up in different areas, and those providers will get the vaccine directly shipped to them. It's not going to come to the health department and then we have to transport it. It goes directly to them.
All right. And if you were in line to get the vaccine, are you going to get injected with the COVID vaccine, or are you going to decline it?
Oh, no, definitely going to get the vaccine.
Okay.
We've been waiting too long for this day. We're getting the vaccine.
How about Jason and Tiffany? Are you guys planning on getting the vaccine?
Absolutely.
When it's my turn, yes.
Yeah,
I'm still thinking about it. I'm just making sure I don't have any interference with, like, allergies, whatever. I don't need an EpiPen, so I guess I'm clear.
Yeah, it's definitely, given that most people aren't in line right now to get the vaccine immediately, right now would be a good time to ask your doctor if any conditions that you have might make it so you shouldn't get it, or what they think about that. I think now would be the time to start that discussion with your healthcare professional that is taking care of you. So we've got 4 out of 4 people on the task force are going to take the vaccine. So I don't know if that's a scientific sample, but certainly it would at least indicate that we think it's safe, and we're here trying to give you, the people of the Coastal Bend, the best information that we can based on science and evidence-based processes. So with that, we're going to wrap this up. We'd like to take this time to thank you, the people in the Coastal Bend, for tuning in. And please keep the questions coming on Facebook or Twitter or Instagram. We're at CBCovid. Once again, at CBCovid. The CB's for Coastal Bend. And it's really you that make the task force work, and hopefully we can get through this together. Yep.
I do have a question.
Sure.
Can you talk a little bit about the positivity rate? There were some changes recently by DSHS, and we're getting a lot of questions on that as well.
Yes, excellent. I skipped right over that one. Thank you for asking that. Okay, we're going into overtime on today's podcast question and answer session. We're getting some questions about the changes that are being made at DSHS, that's DSHS, State of Texas. health services, and there's some changes being made to the way that they're reporting the COVID percent positives and the dates that they're reporting cases on. And so the changes that are being made are essentially, rather than the date that a test comes back, using that date when the test is received, when the answer is received, to document when it happened, they're actually going to use the date that the test was given. And to me, that makes a lot of sense that we would use the date the test is given, because that's the day that the person tested positive for COVID. And so as a scientist, I find it very satisfying that this change is being made. Yesterday, I got asked by, a skeptic that was wondering if this is a ploy to make the numbers look better. I don't think it's a ploy, but there could be an illusion that the cases are always declining, given that on today they won't be completely enumerated. They'll be getting backfilled to previous dates. So the reason why I know this is because that's the way the fatalities are working. There's a 14-day window between when a death certificate gets filled out and when it might get into the state's databases. And so some of the fatality graphs you'll look at from COVID look like the fatalities are always declining, but that's not necessarily the case. It's that they're not all counted yet. And so we might expect to see a phenomenon like that. Now, on the task force, what we've done is we just don't show any of the numbers from the window of time when it's not complete yet. And so we will make adjustments to the way that we present our data so that there's no false impressions that are given from the figures we show. Let's see, and the other thing that's changing at the DSHS is that they're going to start reporting probable cases, especially from antigen tests. And again, I think this makes a lot of sense, because back in the early days of the COVID pandemic, if you got tested, it was the PCR test. That's the confirmed test. But now there's a lot of people that are getting tested that will never get the PCR test. They'll only get that antigen test. And so this is a way to be more inclusive, and it's, if you have symptoms of having COVID and you test positive, then with an antigen test, then you probably have COVID. That's why they're called probable cases. So I think it makes sense to include those also. With the ins and outs of how that affects the task force, I don't think that you all out there need to be worried about that. It's just something that I and my team need to be worried about to make sure that our scripts can handle the change in the data format. And I don't know with that, Annette, do you have anything to add on those points and the percent positives and the probable cases?
The only thing for probables is we probably run around 20% of our total cases are probables. And so, initially the antigen test was not as good of a test as it is now. But if it's positive, if you have an antigen positive test, it's a really good indication that you have COVID-19. So it's gotten to that level where it's really good. It was more of the negative. If you were negative with an antigen test and you were symptomatic, we always ask that you go back and get a PCR test to actually confirm if you really have the virus or not, because it wasn't really a good test for negatives, but it's a great test for testing out positives.
All right.
That's all I have.
Thank you. I see we're being Zoom bombed by the task force director, Dr. Philippe Tissot. If he can hear me and he can speak, we're wondering, Philippe, if you're planning on getting the COVID test. I'm sorry, not the COVID test. We're wondering if you're planning on getting the vaccine.
See, absolutely. And sorry,
Philippe, you're logged in twice.
I ask every time I meet her, I ask Director Rodriguez, where can I get my vaccine? So I am ready. If you need a test person, Director Rodriguez, I'm your man.
And that's a good point, because all of those people that are trying to volunteer, no, we cannot vaccinate you until your turn comes up. So, yeah, thank you for all those individuals wanting to volunteer to be vaccinated first. But we do have categories that are very specific phases that we do have to follow.
And I will be patient.
Thank you.
All right, so now I think we're done with the overtime session. We're really wrapping this up now. Thank you to everybody that's tuning in live or later on. Hopefully we addressed your questions, and if we didn't, please post them on our social media accounts at CBCovid, and that's on Twitter, Instagram, and Facebook, or YouTube also. It's possible to post, and we will work on getting those answers for you. And I want to remind everybody that while we won't be giving a live task force update next week, at least I won't, because there's an election here locally, we will be pre-recording it, and you'll be able to find it the same way that you've been finding the other pre-recorded updates on COVID. So with that, thank you very much, and we'll see you next Friday.